mal globo bay dorai bo me sabalwal mabli takol warar elang egi oy magatagata Barandi musudargu lekate tararo maoi magurga ebe ori redagosoe Barandi musudargu lekate tararo
Okay, I'm going to do it again because I forgot to put the switch. I mean, the switch was on, but I forgot to put the music down. But anyway, good evening across the world, everybody. Good evening. Malungin ko pasangan mergi de rogo ya solang at yang update teleratsil till February 28th at 7 o'clock. Ya solang maganda mo at yagi dat teletela already de algo pasangan. First, I'm going to introduce Retail, and then Retail will go through the updates, and then after that, Retail will introduce the Mike. Introduce Mike, and Mike will introduce our special guest. So that's how it's going to work. And don't forget, let's be informed that if you want to call in, I suggest that we wait until after updates, and then if you have any questions, you can call in at 488-4848. Dire katong tiala daw nga sulir adra Eco Paradise lo bangedra every Monday at 7 o'clock ko malmasaul estola en kadeba time medical tour remedio ko Michael ngumsa diter ambolo mura program bigera besengay. Okay, Retail.
Oy, milgop singe tulir malmasaul milgop singe mar adro gulo rengstra el algop singe ma a minister kama mle announce last week Friday selbura wasay el almong yang mo start di ongeru lurior ma ongewa lurior ang marula updates.
Okay.
El alsil seng wal lakal pornya updates mataygi del program rigida wal goramo o release del update.
Okay.
Ang el alsil so sera ongeim lurior ra edel kloma tedo barayeta sils. So as of 3:30 p.m. sera Friday up until el alsils el Monday kutulurior edel kloma tedob en lamo 595 el testa da conduct ra COVID-19 gigi del 595 el test there 55 amle positive manselle tumong way segi del 55 cumulative number agay sa sergidra sesra dotelo mo el test ra COVID dan melang namo 3,781 adire kal segi over the weekend mail al sils en lamo 198 amla mungil malubet na test out ra negative ra day 5 malubet tamla taying ra hospital.
Okay.
So 198 tigel wada termertil waset na mungil or mla test negative ra day 5 mase total recover der gida namo 3,140.
Okay.
Masel domestra o ureng bulgulo aset tigel current active malubet tigel current active cases ra COVID-19 elang 641.
Okay.
641. Dirga malmol mal 6 tirgel mlamosmer el alsil sa ngara hospital Newing A5. P5 are Newing ra COVID 2 tirgel Newing for COVID. Tirgel spera COVID. Esera da announce sa dora dilul wasem laringi arterungal severe el angeng 5 al mild namo dia are severe or tirgel korak malsmer.
Dirga kamata, dirgo si siul 6
dirgo si siul 6
okay.
La mosmera al COVID au un matamlosmera.
Okay.
El alta met tirgel Newing tatewang arsal imong ardil.
Okay.
Sa uktunguray ga hidale vaccination erstir taterung adirga kalorus awan amlamrus anding dirga kalngwa booster ringi awan aldirga incomplete lendirga ngilu awan al dosra maderna one estira fully vaccinated enonga booster mang again seguido ko dal mutal ko ra dio maklas krar adra importance ra umru sama booster.
Okay.
Ndira kal tirgay gidel wal osong ngaringi angel reveal tira kal toktang ra sidisin lastyang ngamle lore lo bantras toktang lo meser tirgay gidel wal kwa mlen yuing tirgan los mer mo ni hospital gid basta gidira dalongalela luil kapsingila ko telbuila January 20 elmo sa January 24 ang kari little report del mera kamamber sa gidira over a weekend en wal 57 armlamo newing ra el smera COVID.
Okay.
Oy. So lisel 57 na sel lornya sel total el number sel ang listirgel adal whether tamlon newing al COVID ul malubet non newing al nganyangot araktiran bit positive ra COVID. So say gida 57 na kadam nila sa 6 tira amlamo smell COVID ul.
I see.
11 na sirgay gidel lo New Year dimla ka symptoms serti 12 bel asymptomatic so mo asymptomatic ang dimla ka ulang alila COVID state tirgay gidel 11 ng 7 na tira wal fully vaccinated booster 3 booster fully vaccinated dila al booster dito fully vaccinated yawan na tira under 5 barikil.
Oh, okay.
Oy. So, sa gidel, so 11 na out na tirigay gidel 57 na aldulwasing sa asymptomatic. Yung naka-symptoms sa team. Si direk kalkura walol o tila wasay flow to telela the booster ito rus.
The Bruce booster, why say?
Why say. 25 or steer, 43.8 stira asal. Oy. Tirigel roguyel mlora hospital le fully vaccinated abolgula wasay at least 7 months malubeng tara ra riura ngerul daw sa timbergula sa tirgam la mo giri nga booster tir bibla bolola ya booster kalgura miram lamral mo ituta orus mong direk kalgura o tia importance ra omruse.
Include to the dollar cell booster smisi itial immune system ra why say?
Why say?
Okay.
15 undo komeng 18 out ra 57 malubeng dori 2% dimla kal vaccinated.
Okay.
Oy. Yeah, partially vaccinated malubeng tading iluwa one al dose sa Moderna malubeng Pfizer am left 4. Ador tina atrigay del gulsa da tilwa sa fully vaccinated nanding lamo giri del ngwa booster dim la bol ngwa booster ngaringi atrigel mle booster ending wal terus tira ngilwa booster tir sel ra bolsera.
Oh, okay.
So tirgal for some reason nanding la kalo dingel wasit smere mon mutunga orus and then we will test it positive.
Oh, okay.
For tirgel 57 ang rangal kal miki karera krira 5 nandakal sa baril marus.
I see. Kiki del ngal gre lang at mosmer mat nganya kar lulay mon mangil mon mongit.
What akamlu?
Tirgel del miki karel ngal gre lang la sendi na spin malaos. Orus len dimlaka available shots and more tirgel del ngal.
Tuli kam dia katirga under 5 mendila ka bulngan nga orus.
May alam buga sa biseral bol positive tadi lewa sa gid koma mastri atay no.
Why say boy. Tamlen yuying.
Ito na bongin.
Ito na bongin. Why say elam dia ka adal yuying al kikaril ngal ka.
Sel domeste riteren omsindel saal tortiras mer compared to women.
Ngorak medal even a split like 25 out of 57 as all.
Oh, okay, okay.
Why say? And then close tedo partirgal so 50% tertira or half pertiro mendal clo half pertir 65 and over.
Oh.
Potira maklol as.
I see.
Tedo para adal nosmen when you inga ang araw 65. Direct kal 39% tertir ang aringi 4 malubeng bato ara 4 comorbidities malubeng igel dul waseng ngaringi raktir.
Oh.
Ngaringi ngot raktir.
Okay.
So direct kal legal waseng constitutional waseng bododing waseng tirkay gidial ngaringi bato ka raktir masarir kora alit utra badengir amat plote el little cell volse of motamos mera COVID at the most spell mera hospital.
I see.
Oo.
Okay.
So tamil tigal wasay about 39% tira ngaring niya alit utra tira malubeng raktir other than tegi del COVID.
I see.
Oo. So ngora adimlay kay gidya update sergir and then by pawadiluwasen dia kado ola ya hidele eger misel bol by bol marege the ada
eladi kum last time danga show etemle aska radrablu wase MD so we got MD dimla kadul wase MD melgo tor amrigel alu melgo tor bela melangal MD el dobar el algo su salin gadi melgo tor amrigel halle volite dusirngie ya su tamo translate edol mangawe
ya galada di mengei
ali gadi as mangal ritera angarngel lu
dia kay tulig era ka nga sewal ka nga sewal lolyu ide ka nga sewal translate mang ada ito
nito discura Michael into this guest.
Okay, so halibay let me introduce Michael Player kay givya wal gora commander walubeng team leader at kay givya adgora uluay silwaseng ngaring 17-member team mlara sel Office of Assistant Secretary for Preparedness and Response, Rablu Ramarigel, MHHS, U.S. Health and Human Services. But tirakam lamin, lamo erul Sunday. It's been going on 2 weeks now that you've been here. So I'll turn it over to Mike to introduce our special guest.
Thank you, Rev.
And please provide a brief intro as well, Mike.
Okay, well, we've been working here alongside the fantastic staff at the Palau National Hospital, and we've been taking care of the patients here in Palau, and it's been a real pleasure. And now it's my pleasure to introduce Dr. Alex Guerrero. He is a trauma surgeon from New York City who's worked all over the world, from the Antarctic to the Congo. He set up a COVID unit in New York City when things were at their worst and most serious, and he is in charge of COVID compliance for a number of television shows for which he received a Daytime Emmy Award. So, Dr. Guerrero.
Okay, thank you so much, Commander Player. That was a great introduction. Diaz, I have to tell you that you're my favorite Palauan radio personality, and I'm a big fan of the show.
Oh yeah, thank you.
Keep up the good work, and it's a pleasure to be invited onto your show.
Okay, thank you.
So just go ahead.
Sure. So let me tell you a little bit about what we've been up to here and about what things were like in New York.
Okay.
So, in New York, in the end of March of 2020, we were all going about our daily lives, just like all of you. Okay. And, COVID hit us like a ton of bricks. We weren't expecting it. And people thought it was just going to be a flu. And people thought that restaurants were just going to be closed for a little while and nothing was going to be bad. And I remember vividly on March 16th, the governor of New York said that all restaurants that night were going to have to close at 8 p.m. and they were going to be closed for 2 weeks. So I made a reservation at my favorite restaurant because I didn't know, it's going to be 2 weeks until I can eat there again. And at the end of the meal, the chef came out with a giant rolling cart filled with desserts, and he says, "We're going to have to throw these all away, so please help yourself." And I ate more creme brulee that night than I would usually admit. And then within a week, the hospitals were overrun, and it went from it's a flu that's going to be a nuisance to this is what seemed to be the end of the world. Really, it's what it felt like. We had never been in a situation in the United States where the hospitals were overrun. We very quickly had to set up intensive care units, turning entire hospitals into intensive care units, and working like we had never worked before. And, we didn't know what we were dealing with. We didn't know who would get really sick. We didn't know how this was transmitted, and we didn't really see light at the end of the tunnel.
I see.
So things were very, very bad there. And, over time we've learned a lot of lessons, and I think we've come to live with COVID in New York City. And I'm hoping that the mistakes that we made and the lessons that we learned, we can share with you guys here so that you'll have the best outcomes possible and that COVID will have the smallest impact possible while you guys remain safe.
I see.
So I think that's really the point of our mission, is to convey some of that experience. And so far, I think it's been very helpful.
Yeah.
A combination of putting people at ease and learning new skills and how to deal with this.
I see. So what do you think? Do you think we're doing all right here in Palau, the way we set up our programs?
No. I don't think you guys are doing all right. I think you guys are doing outstanding. And
Wow.
I wish you guys would have been in New York. I wish I would have known what you guys know in New York in March of 2020, because things would have been a lot different. But I think you guys are doing amazing. I'm so impressed.
Yeah.
I just can't tell you. I can't tell you enough how impressed I am with how well a job you guys are doing.
Yeah, Dr. Kerr, we are a very, very short staff, and I really appreciate the fact that Rita and Edol, those two ladies with you tonight, they've been working for 2 years now. We've been together. When we first started, we go like 3 times a week. We update the people down to 2 times a week, and now we're doing it 1 time a week. And they're doing a fantastic, I'd say excellent, like you said, they're doing an excellent job, and they're tired and all worn out, but they're never going to quit. They stay there and try the best way they know how to keep the public informed, and we really do appreciate their efforts in that regards.
No, I think you guys are doing a great job, and I'm really impressed with how transparent the Ministry of Health has been.
Yeah.
I think it puts people at ease to know that they're looking out for their well-being.
Yeah.
And keeping everybody informed. I think it's really fantastic and commendable.
Yeah. Okay. So, there's the reason why we're having you tonight. You're a medical doctor, and the public last week when we had the show, that they requested that they would rather talk to somebody with MD. So I said, well. Rita and Edom said they're going to bring MD, but they didn't tell us, that the MD they're going to provide is an English-speaking person,
That's great.
But that's okay, because Edom and I are going to try to translate or summarize what you're going to say tonight in regards to COVID-19.
Yeah, I'm so sorry. My Palauan just isn't quite fluent. I'm still working on it. I've only been here a week, so.
Okay, no problem.
Okay, Masulan.
Okay. So at this time point, what do you think? Since you said you're doing all right, what else can we do? We maintain our prevention program, and and just follow that all the way through. Because the way it looks right now, the numbers of positive every week now is dropping drastically. It's dropping. It seems like that COVID-19 flu is going to be out of the way pretty soon. What do you think? You think it's going to go away pretty soon?
I don't think we should think of it as going away. I think it's going to be more and more manageable as long as we don't get any more surprises. But this virus keeps surprising us. Who would have guessed that Omicron would have come and that it would have been so transmittable? In New York, I do testing for TV shows.
Okay.
And we would have maybe one, out of 1,000 tests per week, we'd have one or 2 positives per week. And then when Omicron came in the first week of December, we started having 30, 40, 50.
Yeah.
Like literally in 1 week.
I see.
Now the good news is that if you're vaccinated and if you have a booster, you're really unlikely to get sick requiring hospitalization. And what we've seen in New York and what I've seen here in my brief time is that it's really unvaccinated people that require hospitalization. So I think if there's one very practical message, it's be vaccinated and get your booster when you're eligible. Okay? Because, I think the concept here is that you're most protected about 2 weeks after your injection.
Right.
And so you want to, as your immunity starts to fade a little bit, you want to get that booster when you can, really.
I see.
So I think that's one very practical take-home point that everybody can understand.
Okay, that brings up a next question. How often are we going to be subject to take the booster or additional shot?
It's hard to say, but I would say it's probably going to be either every 6 months or every year, the way people get flu vaccines every year, at least in the United States. It's going to be, I'm pretty sure it's going to be at least every year, maybe every 6 months. But, this thing is following the natural progression of infectious diseases, which is to become more contagious but less deadly. And this is what we're seeing with Omicron.
Okay. The public health right now, there's announcements going on right now asking people to come and get their annual flu shots.
Yes.
Is it necessary that we get the flu shots plus the Pfizer and Moderna?
Yes, absolutely, because they're two totally different things.
Oh.
If you're somebody who is at high risk for the flu, then you definitely need the flu shot. They're essentially independent vaccines, independent vaccines.
Okay.
Yeah.
Dr. Carrero, can I summarize this in Palawan?
Sure.
For our Palawan audience. Okay, alol goring yang gal toktang tila Dr. Carrero. So long, as you all know, another name, Alex. They call him Alex also. He's a medical doctor, surgeon, MD, specialized in critical care medicine. Okay, out of New York. Ganga marala itself toktang so lang gagidel akul gering ilwase naringi sel flu shots dolaringi bekelrak annually we go to public health and get a flu shot akul gering ilwase sen didai joba dolaringi so la matagida gagid shot el Moderna ma Pfizer and then diungil and diahal korangarni wild side effect ngi gagid mulase bayungil kumuse gid la sugum gora di diaham almost flu malungil omusay del annual flu shots a regular shot flu as well as direct update they stay update with your booster ma cycle additional shots gayudle Moderna ma Pfizer ngayudle sindia problem mem da walasmen omusay the flu shots el direct protector government dia pom se rasumo ko sa ser di selbo bekragang mo flu and Kauya number 1 candidate mo malat the flu shot, cell annual flu shot. Okay, now back to you, Dr. Guerrero.
Yeah. That was a very good translation. You just missed that one part, which is that you're my favorite Palauan radio personality. So just make sure that at some point, you translate that for them so they know, so they appreciate. Okay.
Yeah. Okay. Thank you. Sure. Okay, and if anybody have questions out there, please you can call and speak in English or Palawan. We'll try to summarize or translate your question. So if you have a question to Dr. Guerrero, please call 488-4848 and we'll try to get your question to an appropriate person. Okay? Let's continue on. Can you tell us more about COVID-19, how to prepare ourselves for the next, variant? Now there's what we call AB2, again, these are fake news out of social media. AB2 variant that is going on right now. Is it true? Is it for real? And if it is, how do we protect ourselves for not getting it?
Well, it doesn't matter what it's called, but this thing is going to keep mutating.
Yeah.
It's going to be a part of our lives, and we're just going to learn to live with it.
Oh, I see.
And I think it's just going to get milder and milder until it's like a cold that we just manage. You know, we get the cold. People get colds all the time.
Yeah.
Well, maybe not in Palau, but in where it's cold, we get the cold all the time.
Okay.
So I think it's going to be something that we end up living with, honestly. But for now, it's still something that for vulnerable people, it could be deadly. It's something we need to take seriously, and you need to protect yourself with a vaccine and a booster.
That's right. Because, you know, this is how I feel. Well, I'm not a medical doctor. You know, I predict many things. I say are prediction. I think this disease is traveling around the world looking for those people, just like a bird looking for a nest to lay eggs, right? So if you don't have your shots up to date, then the virus will get you. So what are we saying now is that it's going to be here with us for a while. So by all means, please go get your shots, update your shots, and that way it can help you if you get COVID-19. You don't get really sick like other people that didn't get their shots. Can I say that? Right?
Yeah,
right?
That's a very good assessment. Yeah.
Okay, because you know, like if you haven't got your shot, you know, that virus is going to be looking for you to lay eggs or to sleep. And if you don't have your shot, you're the number one candidate to get that COVID-19. So that's how we look at it and convince ourselves to go out there and update our shots, you know, and practice preventive measures, and that way we don't get sick. But if we do get sick, you know, we don't die unless you have a prior health issues, and then you probably die. But more likely here in Palau, only 6 people out of 20,000, you know, still alive. 6 died because they had previous health issues.
Right. And I think you guys have done an incredible job of getting vaccinated. Now it's time to continue that excellent work and get boosted.
Oh, okay.
Tuli kasi le bring up particular variant ngoram la yisel tara ager sera the talk show was say wara la reinfection. So maybe now's the time since Dr. Guerrero is here to ask about Dee has mentioned BA.2, the Omicron variant. So what is the potential for reinfection of once you've had COVID? People assume that once you have COVID, you are immune, and how correct is that?
Okay, so actually having COVID is in many ways similar to being vaccinated. Okay, your immunity lessens over time. So it's unlikely that you would be reinfected within 90 days. It's more likely as you go down, as you keep going. So maybe at 6 months. That's why it's important to stay boosted, to stay as immune as possible.
I see.
Yeah.
So what about the reinfection of once you've had Omicron BA.1? What's the chances of getting infected with BA.2?
So what we know is from our experience with Alpha to Delta and Delta to Omicron, and we know that it's possible, but if you do get reinfected, it's very mild. It's very mild.
So it doesn't stop you from getting infected with a different variant, but the severity lessens.
Yes, but remember, you can still spread it, right? So the real problem here, if everybody who had COVID, as soon as they got it, turned red and sweaty and had a fever, then this thing would stop, right? Because nobody would go near them. But that's not what happens. So for 2 days before you even have symptoms, you're shedding virus and spreading it all over the place. Before you have a fever, before you have anything. So that's why it's important to really practice social distancing and mask wearing and everything.
Yeah. Makes sense.
Yeah.
So so we can say it's going to be here for how long we don't know, but in the meantime, protect yourself by practicing prevention.
Yeah, exactly.
Measures,
the stuff that's obvious now. Sanitizing your hands, 6 feet apart, avoiding large gatherings, wearing your mask.
Okay.
Very, very simple things. Very simple things.
Yeah, we got a call, doctor. Hold on.
Ako radio gel wasengakan ng awan ma 2 ma 3 mother na.
Oi.
Hindi lakakri ka waseng mlego leto se ka mal di dai job lang ng may rogoy.
Oi.
Lakuri ang selgong arnya booster. Yang gukngod.
Okay. So you agel ngila la Moderna ang Pfizer.
Ang mother na.
El 3 shot and dia al 2 ma booster. 3 shots, why say?
Oh, hindi 3 shot, hindi ka booster.
Ha booster. A question regard lang mo lo say. Ngire mo mala booster?
Oy. Ako malay.
Ta dilur galo sa mo malay.
Hindi ka akmo, hindi ko ano kasi. Mamatri akmlego leto se padi wil musul.
I got your question. Okay, doctor, here's the question. That a person just called, said that he received first and second and third shot. Does he need the booster to go along with those 3 shots?
Not yet. Not yet.
Okay.
Not yet. It's likely that in the next few months,
yeah,
he'll require a second booster.
Yeah.
It's likely we're all going to require a second booster, but not yet.
Okay. So we're going to wait for CDC to tell us, give us a green light, and then...
Exactly.
Okay.
Exactly. It's going to come. It's just how long it's going to take. That's
Okay.
the question.
Okay. Caller, can I understand? Can I 3 shot? Ela sugub tamo mo do wai sergida ruariterel wasay mlamo time. CDC o wai stir gida to wai sergida sem mlamo time tirgem lang ma 3 shots at tegito mo largi como rin sa radio, because social media is radio and television broadcasting all of this information, so please stay tuned mo rin sa gel togoy tobra EOC tira malagel information ra CDC. That's it. Yang de atang. Can you understand? Okay.
Tuling dito maklat kalwase sugo maadang gilo booster and dila albol time for another booster. But if somebody got their 3rd dose, then they should get a booster 5 months out or still 3rd dose or tier.
Okay.
So say gidal dulsa nila last week.
Yeah. So some people, you know, this. I'll try not to confuse people, but some people get 3 shots and then a booster is indicated. It's usually very elderly, immunocompromised people. Maybe you've had a kidney transplant. Those people require a booster in 5 months after their 3rd dose.
Okay.
But it's confusing because some people say 3rd dose, they mean the booster.
Okay.
Does that make sense?
Makes sense. Okay. Here's another call from Iwal. Ali, ungil ka ba sa ngayagabang Iwal?
Baru ko sa tuloy ka, wilo ko sa aditerba. Agora pagilale adra DC. Wilo ko sa dortir. Sei da que já usei quase que habla correr mais já.
Bravo.
Eu quero assim. Já booster era tudo por tudo. El que ayuda a ver el doctor Charles BA2.
BA.2.
BA.2. Algo bem. El que ayuda el chat blood right.
Ay.
Igual subir con ya de ser balbo. Abrir el suelo balbo ya de balbo charra. Seguida que.
Oh, hindi iwan agirgaw?
Di wat ayuda el di mari sticker quasi que ayuda. Ayuda el blood cell del test el block con la verificar para dia.
Oh, magara sa sen ang spera booster malubang another shot for prevention of BA2 malubang ang diabom sera BA2 tilagi dakarim.
Al seguida que era quasi blanco booster.
Oh.
El que ayuda el doctor. Suel help for you de ser balbo brillo suel balbo ya de balbo ayuda doctor.
Bogo dia Q-tip sergaya mergom pina dinga mergoya guger ngir mergoy ko malmong irong sim ko ay sira our listeners sergawe. Okay. Dr. Guerrero, here's the question from Palau. He wants to know if he needs a booster for BA.2 variant. That he already got the booster. He's a J3. I know him because he's a good friend of mine. He received J3 Johnson & Johnson, and then he's got a booster for Johnson & Johnson. Maybe last week he did that. Now he wants to know if he needs a booster, if he's subject to get a booster to prevent him of getting BA.2.
So when we talk about vaccines, we need to just think about it as COVID-19. There isn't an Omicron vaccine or an A2 vaccine or a Delta vaccine.
Yeah.
It's really COVID-19. So if there is another variant, just like there was with Omicron,
right.
The booster is your best protection against it. So if he's boosted, then he's as good as you can be for right now.
Okay. All right. I understand. Okay, so that's the guy we do a show every Tuesday and Friday. So I'm gonna call him up and explain to him exactly, not to worry about the 8.2. Okay, let's continue. We got about 20 more minutes to go. Caller 488-4848. Ask your question. Dr. Guerrero, Maluban Riter, Maluban Edol, Tira Omora Argidere Algasus. For 488-4848 ating wargit, okay? Let's continue on, Riter.
So, Dr. Guerrero, maybe you can talk a little about infection control, the importance of limiting traffic in and out of the hospital. I know we've got a lot of complaints when we tried to implement a lockdown at the hospital of allowing people in, and maybe you can touch on that a little bit.
Sure. So, when a loved one's in the hospital, the nicest thing is for a lot of people to come visit them. It feels good when you're sick to have all your friends and family come visit, bring flowers and cake and everything. Mm-hmm. But with COVID-19, that's just straight up dangerous, okay? Because you're introducing people from the outside that may or may not be tested, who may or may not be carrying COVID, and now you're bringing it into a hospital filled with people who are already sick, either from COVID or from other things. So it's the worst thing you could do. So I think it's important for people to appreciate that the hospital is a sacred place, and we try to keep it as isolated as possible. So if you want to come visit a loved one that's in the hospital and we say, I'm sorry, you can't, we're only limiting it to one person, and that person has to wear an N95 and a gown, and we have to test them and do all these things, just don't give us a hard time, because we're doing it to protect your loved one and to protect the community. Okay?
Okay. I got another question for you. I don't know if this makes sense, but when we're watching the war in Ukraine, and when you look at the people, they're running for their lives, and we don't see anybody wearing masks. Do they have the COVID-19 problem like we do here in the West?
I think if you're running for your life from explosions, you're probably not worrying about infection control. Okay. I'm just going to guess. You're just thinking about what's going on right now. I think they have COVID just like the rest of Europe.
Yeah.
But I think they have other priorities. They have even more short-term priorities than getting sick with COVID right now.
Yeah, okay, because I see Russians also that they don't wear masks. I think they're trying to win the war or something. Anyway, next question. You can call again at 488-4848 and ask your question, and we'll address it to appropriate person, okay?
Tuligal dongi lagi edik announce igal schedule vaccination el week.
Okay.
Yes, so today was Pfizer. Segi dele kada namu balmora PCC cafeteria.
Okay.
So yaklugo al Tuesday March 1st kada mutal nga PCC cafeteria.
Okay.
Kada do maklat ka tirgen nga ringar 8 tel pending second dose tira Moderna leklugo temela Moderna.
Okay.
Malautakang almer segi de klugo kora 3 p.m. to 6 p.m. ra PCC cafeteria.
Okay. Caller, you're online?
Oy.
Kabo.
Padungir kam singet tulik.
Yung kung sangay.
Yung singil mo na letter mangkalang nga tanga CDC. Total marmang malum lima kung gusto kan mo matangel wasing. Tirkel na ama vaccine.
Oy.
Kasel gersen mo manegal talk show.
I see.
O mong saan mo matangel wasing telal averbelam na ama vaccine mosme a COVID. And maluin kaya gidili omspro naman.
Mosme el mat? Tadi mosmer alum sam mo de sitas telar tiram lo tirem los el mat ang ila A shot.
Ya, asal gugurnya wasit. Pengina a vaksin.
Oi.
Atom namo COVID. Kaya letter wasit mo tuliya. Kira malus statistik sir kami wasit. Kaya alam nama vaksin.
Oi.
Kaya alam namo COVID.
Okay.
Oi. Agora, lista. Ako nga result sa momennya wasit kal. Kal spike protein. Ay laboratory mirror ya. Mililikya emergoway versel dulu asin side effect terjal el vaksin. Au ulun dia kan sebenarnya ada tu tak lalu ambil jel surah ambil med terwasing. Agi surtia lagi ngila vaksin ni muslim. Segi de lekter mo soal membangi sel dailan maru analysis kami wasing. Jadi nama vaksin tetelar tilam na muslim COVID.
Okay, detail limora question highly technical and we only inform you for what we know from CDC or doctors from CDC or in this case, Dr. Carrero. We cannot go to a technical, very technical about this thing because we don't know. We're not doctors. We only provide information that they are providing to us. Okay? But the other question,
social question na oger was saying tirakal roguil mlamrusen tetel mlama vaccines telar tiram lamat so arranglel tirai gidel telar tausen mlama orus rawa situatan nama darinya sedia ku bang
ako sa question na telam lam
tiral namat
los mer Masa elang suku 5,000 elang amla fully vaccinated. Terar tiram la mosmer. Say ako mas
okay, so seguira mal momrula yagi dele analysis at yagi del 3,000 so se ngarngi yagi del duru larngi gora gi multabdi.
Ay.
Tele wase multabdi sa Friday. Magdawaseng 3,000 sera the Friday do lorito kasi 3,714 numbers habla the plan kora analyze it ringi tiragi del adara ubur ngarinya 12 ringi so segi del timing lewal 3,726 a number of cases rigid so ngarinya 12 numbers na 12 cases and wal dirgal verify malbit validate at so segi del cell 3,714 85% tira vaccinated. Ela selgu kwasay ta fully ta partial se bang.
I see.
Tidi do Mr. Selo ura 3,714 cases, 85% of them were vaccinated.
Okay.
Say atarimal number by its low number compared to the vaccination rate that we have.
Okay.
Because the vaccination rate do bang about 98%.
98%. Okay.
Yes. So, kada expect was sayar adal musmer, abatokal other belawar rus.
I see.
Why say? So, 98% total population are dulasing vaccinated, but only 85% of the cases are vaccinated.
All right. Thank you. Very clear. Okay, Dr. Guerrero, excuse us, but as you know, we have a lot of researchers, local researchers, and also the sharpshooters, and people try to be a doctor and analyze this whole thing in different ways, so we have to be patient with them, yeah? Okay, here's the next question. Ali kabo ang ngarngalulu.
Hala kiri sa.
Kabo. Ali mo ko tora madigan dia ko lida tigingem.
Ko tabula ble ko olito.
Ya, alam digaw lo ko kera tigingem dia ko lida tigingem.
Pero ko aristera o sige baka pa hala na kapit valor yung arigang.
Okay, go. Moro daw.
Atagi. Sel dober sakal gasto lela ba para sa state para ga gil tabadak talbasu.
Ay.
Pelang suel gila gidel al doctor ko rule te adra bro belak bo sigagil para sa bagal.
Okay.
Pasule dia na badak.
Okay. Dr. Guerrero, we have a problem. It's a unique problem here. The Minister of Education said it's safe, that your children come to school because less than 50% show up for their education, In other words, nobody wants to go to school. And mainly parents are holding back their children, not allowing them to go to school. So the question I think he's trying to say is that how safe is it? Can you tell us that don't worry, let your children go to school, their immune system works, it's better than the 65-year-old men or something like that? We need your help to convince us to allow our children to go to school.
So that's a great question, and I can see why people are confused by the mixed messages.
Yeah.
I think it's pretty clear. There's 2 points I'd like to make. One is, when children do get COVID, it's very mild, or usually they don't even know it. Okay?
I see.
Okay, so it shouldn't be, people shouldn't think of it as putting their children in danger. Now, the danger is that the children will get COVID, come home, and spread it to a vulnerable adult. So that's the one thing you've just got to be aware of.
I see.
So, I think it's more their role in spreading it as opposed to them actually getting sick. So as long as people understand that, then I think going to school is plenty safe.
Safe. Okay. So you hear that, parents? For those of you that's afraid to allow your children or child to go to school, don't worry. Be happy. Okay.
The children should just wear a mask at school and follow whatever guidelines the Ministry of Education is putting out.
And
it really is safe for the children. It's very safe for the children.
And of course, we got to follow that. When they come home from school, tell them to go. First thing they do, go into the bathroom and wash their hands.
Yeah.
Yeah. And make sure that when they go outside, like going to school, wear their masks. All right?
Right.
Okay.
Right.
And because education is very important. Ngila mo mangil wa sa schoolia ngalgeda da sa do sa skorni. Okay, amos mer tial COVID ngalida tokta Dr. Carrera wa say and save pang altanga bebira time ngal ka mosmer sola di halo ngil wa sa kismer ngul mer apply spread ngil mortigal at tial bla rogun mo ogurgi ngil sel meg da mula se ngata imame follow ay gidel preventive measures. Okay, had one next call. Lead WFM ngul gusngay.
Oy malungil ko sa biya sa pradi ogel wase. Ngalang ko mo affect ra immune system riki ka sugub makatuti malamol malmalat ya lorus. Aya will affect ra immune system riki.
Okay, Mega. Okay, the caller said if we continue to get these boosters and additional shots, it's not going to hurt or have a side effect, in our system.
It really shouldn't. It really should not. And the risk of COVID far dramatically, maximally outweighs whatever minimal risk there is to being vaccinated.
All right. Okay, this is the time you've been asking for the MD, so we got an MD right here. So call 488-4848 because we only got about 6 more minutes and then we end our program. Do you want additional questions, Eriter?
Kora diom da so igel mla momre gal shorgi da igel kora questions blel askar as.
Oy.
Diga do kora mla mo tatsa igal I think agana mo tatsa igal rowe ge hidil wa reinfection ma boosters ma infection control ma Mela by dongi lagi recruit continue to ligra a scheduler vaccination.
Please.
Oy. So a Wednesday ang direct kalnganya Pfizer lomrus ratigay gidel al ngara mikarel ngal kama 5 years old and up morngira sa gidel PCC cafeteria. Others stay ang mornga omral mabilio will ngaring itirgel do for their second dose.
Oy.
Magyal ngit tiro maklat kartiro asay mautakangal mema ayay gidel second dose kamura ablilio.
Okay. Okay, kabo caller.
Kaya kunyan wasong para related mortal mosagring ilang hindi taritira sebel engineering kamamamlo hospital testover kamamlo sendi kal sebi mer hospital mlari appointment ter kamam. Namo sebel mo mesrar tok tangal hindi ka.
Kabo man Riter.
Appointment terkara.
Pamisa.
Klinik ara NCD.
Oh, sige na lol gorgi. Unless sorry lego lo sa tokta dito sa India ko me unless yung nga appointment terkaw.
Unless ang nga appointment terkaw. Hindi ka OPD open for any walk-in. Yal sugo maada smell o spe access ra OPD and sab ariral mera OPD may access care. Hindi ba haling ka kita adol mabile sa perwas mo dia tetele la NCD clinics.
Okay.
Kamal na saul. Electrical hooks mera NCD giril mera clinic sa agibom appointment still morsel CHC Tara Horror Elementary School. Tulik ko dokor amoro ida tel klol hospital lete kita buto kar adan meringi tira kor o dal maul magi makote kodor trigegi del kor amla modua appointment stir mustir lo tamel serva selleme agi test stir el sugu mata positive agi mistira karvis eta mosab il mistri trigel toktang artir so sa kita kor amle o mu uluriyo last week asugum ko kor ka smer gira mga NCD clinic and semelo kodor toktang arkaw mo advisor kaw.
Okay. Well taken. Okay, we got 5 more minutes. You still have a question or questions, you can call us for 884848 because I think it is the only time you can talk to with Dr. Guerrero, and we're not going to see him again. You know what? He just made a comment before we start the show that he enjoy watching us, especially at Dia's show. So I want to know, Dr. Guerrero, if you have somebody nearby to translate for you, or you can understand what we're talking about in our show.
Well, I can just tell by your energy and your charisma exactly what you're talking about. It's like watching an opera in a language I don't know. I just get it. I just get it.
Yeah. You have to have a lot of sense of humor in order to understand and enjoy. It's more like entertainment, but at the same time, I bring in some educational program that is good for the people, Some people get mad at me and get pissed off, and then they'll get over it, type of attitude, But in the meantime, we have this COVID going on right now, so we need some sort of entertainment, you know what I mean?
Yeah, I get it.
Yeah. Okay, let's get this last call. Excuse me.
Tulig hale direk kal digo maklat kartirgel rogul ngar omral mel waset mal direk girirel meragel day 4 testing. So sesu mangara UL mek merdra butu tara Friday ngirel mera Monday ra dalong lela 9 doril mo 11 doril me test.
Okay. All right. Okay, kabo caller.
Yeah, karigal mo ra tol ma.
Oh, kabong.
Lalandir ka doktor.
Alalandir ka toktang
Hoy, mandir ka toktang.
Ang naramang erula kalikal appointment ka mama bibiyakal sa amlurit seringima. At yakalo makadongor ka ma'am.
Pere el dilungira ka empoler nga 775-1138 Enter el mak question ka oy.
Okay. Sulang.
Oy.
Okay, seguida maulubong rasyo gid. Thank you everybody. I'm going to give the microphone to either Riter or Adol to say good night to everybody, and also say good night to Dr. Guerrero and Mike if he's still there. Okay.
Masulang, Diaz. Masulang.
Okay.
Masulang.
Dia mo kamal masal rohuy matiral ruba ka matamal masal makuk next week.
Okay. Next week Monday 7 o'clock. Thank you.
Yeah, di ulat tulik hal nga kamla obes. Musubes kamtingay gel ko daily updates dul top dra mandel mo Friday. El al week ka mo start tel di meruringira Monday, Wednesday, ma Friday.
Okay.
Gora gel sil minister ako tsakabol update tra radio ra Tuesday, Thursday gida ako marula gel daily update rigid.
Okay,
tulang.
Yeah, thank you for being with us around the world, New York, California, and Hawaii. Thank you. This is Alfonso Diaz. Bye now. We'll see you next time.
Radio Rey, calmar al dimeangla, es el